Our teenage years are a time of immense change. It's a whirlwind for our biology, our psychology, and our social worlds. Like Dorothy in The Wizard of Oz, we're swept up into this world that we can't quite comprehend. Leaving the primary colours of our childhood behind, we find ourselves stumbling through a kaleidoscope of bad hair days, troublesome skin, and pressure to keep up with the latest stars on Instagram. However, unlike Dorothy, navigating adolescence is not as simple as following the yellow brick road. In fact, it's a time of significant vulnerability for mental illness, especially depression. Over half of depression cases emerge by the age of 25, and according to the World Health Organization, depression is the leading cause of illness and disability in youth. Adolescent depression is typically a more severe form of the disorder, and it's notoriously difficult to treat. What's more is that the risk for recurrence increases with each episode experienced. After one depressive episode, the risk for recurrence is 60%, but by the third episode, this risk has risen to a sobering 90%. So, on a closer inspection of this whirlwind, it appears that there are prevailing winds in this direction towards mental illness that increase in strength with the number of depressive episodes experienced, making it more and more difficult to move back over here towards well-being. It would also seem that the experience of depression itself makes some young people more vulnerable to further depressive episodes. However, there are others that only experience a single episode of depression. Why is this the case? Are there certain risk and resilience factors that can help explain these different trajectories? To answer these questions, I'll recruit two groups of young people, one with a history of depression and another who have never been depressed. My PhD will examine biological factors like stress response, psychological factors such as coping styles, as well as social factors like interpersonal relationships. And it's also really important that we give young people a voice. So I'll conduct interviews with these young people to capture the lived experience of adolescent depression. The goal of this research is to develop novel interventions so that young people can build long-term resilience against depression. Ultimately, we want to change the direction of these prevailing winds, allowing young people to pave their own yellow brick road away from illness and towards health.